So, welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have a really great guest that we did our first episode together last year, and he agreed to come and do a part two since there's so many more things that we wanted to talk about. And this is Dr. Joseph Katz. And Dr. Katz is a professor and head section of oral medicine at the Department of Oral and Maxillofacial Diagnostic Science at the University of Florida. Dr. Katz has been an active patient care practice and he is deeply involved in teaching and translational research. He was trained at the Hebrew University School of Dental Medicine, where he received his D.M.D. and a resident in oral medicine, followed by a fellowship in the Eastman Dental Institute in London. Dr. Katz is a member of the American Academy of Oral Medicine, and he has authored more than 220 peer-reviewed publications and sits on educational boards of various scientific journals. So thank you again, Dr. Katz, for doing this with me again.
Sure, I'm happy to be here.
Great. So you want to briefly introduce yourself and your area of dental specialization?
Yes, so oral medicine is a section of dentistry that looks at the discipline that is trying to bridge the gap between dentistry, which is more like mechanical, and medicine. So in other parts of the world, like in Europe, for example, this is actually a specialty that is stems out of medicine. So first you study medicine, you become a medical doctor, and then you do this special training. We really don't touch on the dental aspect so much, but more on the medical aspect of of the examination of the oral cavity, the different conditions that are unique to the oral cavity. I can mention one, for example. This is, in my opinion, it's one of the only few that you can find only in the mouth, and it's called osteonecrosis of the jaw, and it's actually associated with cancer. It's something that we see in patients that are taking anti-resorptive medication, whether for cancer or osteoporosis, and this can result in a rotten bone or exposed bone that does not heal. It's a side effect of a drug, and you cannot see it in any other part of the body other than the oral cavity.
Oh, wow.
So this is just an example. So we see it in patients that have multiple myeloma, which is a bone cancer, and they are prescribed this medication by their hematologist, and sometimes they don't mention to them that this condition can cause this debilitating lesion in the jaw that can actually cause fracture of the jaw.
Oh, okay.
So this is a very significant complication that results in an area in the bone that is going through necrosis and is not healing. It happens in the cancer patients in about maybe 10% of the population, but in the osteoporosis, it's not that common. It's less than 1% or 0.1%.
So
but this is, go ahead.
Sorry to interrupt. So I know this is, what is the medication name of it? I'm just blanking.
Yeah, so there are different medication. They're called bisphosphonates.
That's right.
But it's not just the bisphosphonate. In addition to bisphosphonate, we have also anti-angiogenic drugs for the treatment of cancer. So medication for breast cancer or prostate cancer. So the idea is, on the medical side, is to prevent bone resorption. So if you have cancer will resorb bone. So, and if it's multiple myeloma or a metastasis in the spine, it will cause bone resorption and collapse of the vertebra. So in order to prevent this, they are prescribing this medication IV in the case of bone cancer, and this will prevent this resorption from happening. But then on the flip side of that, it can cause this condition where bone is not cannot go through remodeling, and can cause this osteonecrosis of the jaw. It's kind of similar to what we see in the field of head and neck cancer in patients that are being given radiation, and we get this condition which is called osteoradionecrosis. Mm-hmm. It's a different in the in many aspects. It's a completely different condition, other than the fact that eventually it can cause fractures.
Mm-hmm. How can people prevent that? Because, we have people who is like, well, I need to do something to try to avoid fractures or osteoporosis, or how I can help my bones not to become so fragile, but how can I monitor that I'm not developing any condition on the jaw?
Right. Okay. So this, so I'm actually jumping because I just starting to talk about the field, and I now got into this, but I think it's important.
Yeah.
So, for example, because of this oral complication, we have talked to the oncologist, hematologist, and instead of giving the medication every month, they are giving it every 3 months.
Okay.
This will reducing it reduces the prevalence of this phenomena. That's one. Now, this condition can happen also after dental procedures. So let's say a patient that is taking the medication and suddenly they have pain on their tooth, and they go to a dentist. The dentist will pull out the tooth, and then it will create this osteonecrosis. Okay. So osteonecrosis can be spontaneous, but it can also be induced by surgical procedure, such as extraction or implant, because people not being aware of this. So what we suggest is that before a hematologist or even endocrinologist who is prescribing the medication for osteoporosis, right? Before they prescribe the medication, they should send the patient to a dentist, and the dentist then should finish or end all their dental treatment before the patient starts taking the medication. This is very important because here we are dealing with prevention rather than treatment.
Yeah, that's a very good point. That's excellent. So that kind of led me a little bit into my next question is, what is, you already kind of mentioned a lot about the connection between oral health and systemic disease like cancer. So if we want to start touch base now on your specialty, which is that connection, right?
Right. So this is huge topic, what we call the oral systemic connection. And the research on the topic is really, it's like a snowball, because what we see is that oral infections and oral diseases are connected with a whole bunch of conditions that we have not known before. So, the most common are cardiovascular disease. Mm-hmm. There's a lot of evidence showing that periodontal disease and other diseases of the bone in patients with dental problems. If you have inflammation, think about a patient that is the age of 40 to 60, 70. So we have like 20, 30 years of progressive inflammatory disease. So those periodontal disease will release all kinds of inflammatory products like cytokines, all kinds of mediators of inflammation. Mm-hmm. And this mediator of inflammation that are secreted by periodontal disease will then get into the bloodstream and will affect other parts of the body, in this case, the coronary arteries. And there's a lot of evidence how periodontal inflammation will cause downgrading of different factors in the coronary arteries and be implicated in conditions such as atherosclerosis, which is the main process that will cause clogging of the arteries. So that's been shown that PG, periodontal disease, especially a specific bacteria, which is called PG, Porphyromonas gingivalis, has been shown to be present in coronary arteries and atheromas. So those are the things that clog the arteries.
Okay.
So it's been shown, and also other conditions such as stroke. So stroke is also what we call cardio. We call it when you have clogging of the small arteries in the brain.
Uh-huh.
It causes palsy of half of the body.
Oh, wow.
It can be motor or sensory deficit, and those also the same process that causes the coronary artery to clog can happen in the brain, and then we get this stroke or cerebrovascular disease. That's what we call it. And now other diseases such as lung diseases and different cancers, especially oral cancer and then diseases, cancer of the GI tract, so that would be stomach or colon. And interesting enough, recently there are some reports about pancreatic cancer, which is a deadly cancer. People die within 4 to 6 months very quickly. But they actually were able to show the presence of oral microbiome, so microorganisms from the mouth, from the oral cavity within the pancreatic cancer. So somehow the bacteria are able to survive and then go by the bloodstream and harbor in different parts of the GI tract. Now, again, the key word here is inflammation. Yeah. Is inflammation. When you have a long-standing inflammation, it can cause all kinds of ailments, and that's probably the mechanism that we assume that is causing this cancer. Now, recently, I've heard something interesting, not necessarily cancer, but a very common condition that may affect all of us when we age, and this is when we get cataracts. So, somehow the, cataracts are also being shown to be caused by oral microbiome, which brings me to the next one, which is Alzheimer's disease.
Yes.
So there's evidence that oral microbiome is involved in Alzheimer's disease.
Oh, wow.
So you have many reasons to keep excellent oral hygiene, go and see your dentist, which are not necessarily related to the keeping your teeth in good shape, but sustaining your different function of your body, and making them keeping them in good shape. So this is the oral systemic connection, and where we show that the oral microbiome affects the other parts of the body, other systems, and also we know that there's a bidirectional relationship. So, for example, stroke patients, they have problem with their mobility and their motility. So their motor function are affected. So they don't brush their teeth.
Yeah.
Right? And then they don't brush their teeth in a good manner. So they get more problems, which cause them then more morbidity on the medical side.
Wow.
So this is a very, very important link. And unfortunately, I think that the medical profession, more than the dental, they are not aware of all these connections, because these topics are not being taught in medical schools.
Yeah.
And there are some universities where dentists from my specialty are actually going and lecturing to the students, the medical students.
Good.
But it's not done everywhere, and I think we should probably work on this better.
Yes. Yes.
In this respect, I'm going to mention something which I found just recently, because I was interested in the association between HPV, with the human papilloma virus, and cancer. So you'll be surprised that only about, I would say, 20 to 30% of the medical profession are familiar with the link between HPV
Wow.
and oral cancer.
Mm-hmm.
And this is really mind-boggling because HPV is known to cause oral pharyngeal cancer. But, because of this disconnect between medicine and dentistry, the medical doctors, they know everything about cervical cancer.
And that's what they think there's a correlation there. But
Well, yeah, but if you are a mother and you have girls and you have boys, you go to see your primary care or their primary care, they will talk to you about vaccinating the girls because of cervical cancer, but they will not talk to you about the boys.
You're right.
And actually, males are more affected by head and neck cancer than females.
Yeah.
So, the vaccine is actually available, but we don't talk about that, in the dental office or in the medical office. Only 5 years ago, the FDA has approved the same vaccine, the Gardasil, for cervical cancer, also for boys, to eliminate head and neck cancer. Mm-hmm. And what I'm doing right now is I'm trying to educate, the dental clinics, the medical clinics, the students' clinics here, that we should be talking about vaccination because it's much better than, treating somebody when they are 50, 60, 70, and their immune system is already regressing. And we can actually eliminate this by giving them the same regimen of a very safe, I should say, vaccine.
So, Dr. Katz, do you know the reason why you think is being more affected, like for head and neck on males versus females? Do you think it's because part of it is the vaccination, or is any other route for it?
No, so let's talk a little bit about oral cancer, head and neck cancer, because that's really the main topics that we want to discuss. So first of all, as a dentist, I see, and I think most of the dentists, we diagnose the patients in an early stage of the cancer. And the reason is being that, it's usually missed by exams. And that accounts for the fact that the 5-year survival of head and neck cancer is a little bit higher than 55% or so. Mm-hmm. We still have 45% of people that will not survive in the next 5 years because the cancer has been diagnosed in a late stage. Mm-hmm. Okay, now it's also a fact that it's not the most common cancer. It's number 7 or 8. Mm-hmm. First being lung, and then you have breast and prostate and the GI cancers. So the medical profession, they're not very interested in that because it's not very common. And also, unfortunately, if you think about your primary care physician, they really are not taught to look in the mouth and look for cancer. Yeah, they basically focus on the tonsils. Yeah. If the kids have, if they have follicular tonsillitis, if they have any, but more than that, they're not being taught. So that's why, many of the patients will miss their diagnosis because the medical doctor is not interested or he doesn't know how to look. And cancer will have different forms. Oral cancer, it can be in the form of a little nodule or bump. It can be an ulcer. It can be a white patch, or it can be a red patch somewhere, especially on the tongue or other parts of the head and neck. So it's going to be missed. So the question now, why men are more affected than females? I think it has to do with the traditional risk factors. So in addition to this virus, which I mentioned, the HPV, we also talk a lot, and that's on the traditional risk factors such as smoking and alcohol. Mm-hmm. And I think overall, we can say that men smoke more than females. And they also drink more alcohol, and also the synergistic effect of having both risk factors. And also marijuana, for example, marijuana is also a risk factor for head and neck cancer, and I think that mostly because it's they inhale the marijuana, and when they inhale, they still have the risk of the usual smoke that can cause cancer by itself.
Okay.
So that's something that we need to consider. Although, some patients benefit from marijuana, especially if they have had a neck cancer because of the pain, because it reduces the pain level and it enables them to deal with the morbidity of the cancer. But I think, going back to the vaccine issue, I think that we should be promoting more vaccination of boys the age of 90 or so. I mean, I was age of maybe, I'm sorry, I have a phone call that I cannot.
Sorry, that's okay.
So we can maybe vaccinate them when they're teenagers, when they start their sexual activity. So I know it's a little bit different approach, but I teach my students that in at least half of the cases where HPV is involved, oral head and neck cancer is actually sexually transmitted disease. So about 90% of us will be exposed to the virus sometime, and most of us will be shedding this virus, eliminating it from our system. But in some patients, or some subject, it will just stay there and it will be in a dormant condition. And then at some certain age, especially if the patient is also smoking or consuming alcohol, it will then develop into cancer. So by vaccinating the boys, not only it will protect them, it will also protect their spouses if they were not vaccinated.
Yeah,
and that's a very cheap and safe things that all we have to do is just promote it to the medical field, so they can recommend it, because patients will listen to the medical doctor when it comes to vaccination.
Yeah, that's true. And then what is it is an adult age, right, that they're able to get vaccinated up to, I want to say 40s?
Yeah, so the younger you are, the better the vaccine will be. You become older, your immune system is not going to make antibodies to the vaccine. So I think probably like the late 30s, that's the limit for vaccination for HPV.
Okay, got you. If we go back a little bit about the association with oral health and all these different systemic diseases, what are your thoughts about mercury in your teeth?
Okay, so it's well, so the bottom line is there is no mercury in the teeth.
Okay.
There's no. So what you're referring to is actually what's called amalgam.
The amalgam, yeah, that's
Amalgam.
right.
So amalgam is a form of mercury that is actually incorporated, and it creates a new compound, and the mercury is not free. You actually get more mercury from eating fish like tuna, than mercury from fillings. And there were a lot of studies done at the NIH where they were looking at the effects of the mercury, and they did not find any ill effects of mercury. So in the contrary, amalgam is one of the safest filling materials. Although in the recent years, they found good substitutes. So now dentists are usually not using amalgam because of all this concern, but it's more like a myth. They're using what we call compound materials, which are more aesthetically appealing. You don't want to, smile and show all your fillings that are made of amalgams. But there were many studies, especially in Scandinavia, where they replaced all the teeth that had amalgams, replaced them with composite materials, and there was no difference in anything. The patient did not benefit from any of these things.
Yeah, I just have heard some more in the functional medicine space about how that can create some like chronic inflammation as well. and some toxicity and things like that start because, like you say, the correlation with oral health and everything on your system, how that can add up into the toxicity that can be happening in your system. So I just want
Right. Yeah.
to
I mean, I had a patient once that she had a lot of medical issues, and she was 100% sure that it's because of the metals in her body somehow, and it's very difficult to find out exactly. So finally we went to taking some hair samples and sending it to a lab to establish how much metal alloys that she had in her hair. But I don't think there's a really good evidence showing that something that we do in the mouth is affecting the rest of the body. There are different things that we should be, and we should probably focus on the microbiome. Mm-hmm. So I want to talk a little bit about the microbiome, if you don't mind.
No, that was going to be actually my next question. Is going to be oral health and GI correlation. So that's perfect.
Right. So what is the microbiome? So in the body we have about 1 trillion cells that are human cells, and then we have about 100 trillion cells that are not our cells. That they are part of cells of bacteria, mm-hmm. or viruses, or fungus. Mm-hmm. So can you imagine? If you look at a typical patient, if you look what happens in their gut, and remember the oral cavity is part of the gut. Mm-hmm. It's about 6 pounds in our gut that is not ours. It's just microbiome.
Wow.
Bacteria, fungus, and those guys in the microbiome, they've been around for millions of years. They are very adapted to the human body, mm-hmm. and some of them have a very important function, and some of them can also cause damage. Okay. So part of the important function will be, the bacteria in the gut are actually making vitamin K, and vitamin K is very important in the process of coagulation. So when we have a bleeding, it will not stop if we have vitamin K deficiencies. Okay. So we get some of the vitamin K from kale or from other vegetables, but it's very little. Most of the vitamin K comes from the gut. Mm-hmm. Now, can you imagine what will happen if you have a patient and you prescribe them antibiotics?
Yeah.
And the antibiotics now will wipe out all the vitamin K producing bacteria. Patient will have a bleeding problem.
Yeah.
So there's another function which is important. We don't think about that, and that's about 70% of the serotonin, the factor that affects your mood, mm-hmm. is actually made in the gut. Mm-hmm. 70%. Wow. Now the question is, how does it get from the
brain,
from the gut to the brain? Yeah. But there is a nerve. It's called the vagus nerve, uh-huh. that goes all the way through, and it passes the GI tract, and then it goes to the brain. And that's how, eventually the brain is going to get the serotonin. But when somebody is prescribing antibiotics, they are increasing the risk for depression, by maybe 3 to 4 times.
Wow.
So patients will get antibiotics and they will get depressed.
So imagine what happened with all the pediatricians that start prescribing antibiotics over and over for kids. Like you start to getting them already.
Well,
that since
of course, and fortunately, the body very quickly will rebound. Especially the microbiome of kids is very rich, and it very quickly rebounds, and it will make the factors that are important. But this microbiome has a lot of functions. So I'll give you an example. They did a study once, and they found in the study that women, mothers that have C-section,
Mhm.
The babies are born and they have much more allergies
Mhm.
and issues with their immune system. So what they did in another study, they actually got some washings from the mother's birth canal, and they immersed the babies that were born in this washings, and the baby did much better.
Mhm.
So just to show you that the microbiome has a very important task, and we don't want to eliminate this from our body. So it's especially important, because think about what we are doing when we're recommending the patients to use mouthwash that will be bactericidal, like chlorhexidine, for example, which sometimes we prescribe to patients, and then the patients will eliminate their flora in the mouth, and then they will get yeast infection, or they will get hypertension.
Hmm.
So that's something that I'm focusing on research right now. So apparently, there are some bacteria on the back of the tongue that are producing nitric oxide, and nitric oxide, which is found, let's say, in beetroot.
Mhm.
It's uh, it's vegetable. It actually keeps your blood pressure down. When you wipe away the bacteria from the back of the tongue with chlorhexidine, you can, and it's done in a chronic manner. You can actually increase the blood pressure of the patient.
Oh,
So
wow.
so in a healthy subject, it's not a big deal. But if you have somebody who is bedridden, somebody who is not exercising oral hygiene, but the nurse comes and she uses chlorhexidine to clean their teeth or something like that, over time it can cause a lot of issues with the blood pressure. So
Hmm.
that's something very important. So
So sorry. So we shouldn't be using mouthwash.
no, I didn't say that, but we have to make sure that we use it, in a timely manner. So we use it maybe a couple of days, and then very important to help the mouth to rebound. So how do you do this? You can do it by. So I recommend my patients that are getting antibiotics to use Greek yogurt, which will be the natural probiotics. I really don't believe that there is a good strain of probiotics that you can get in a pharmacy. Um, it has to be something that has all the lactobacilli and others. And I'm not sure that the common person will know what to ask from the pharmacist. But so that's why I recommend this Greek yogurt, because it has a whole bunch of probiotics that helps in returning the flora into healthy and normal. And also, I don't recommend using the mouth rinse for a very long time. So usually it will be, if you need to be on this because of dental reasons or medical, use it for 2 weeks, take a break for a week, replenish the flora, and then you can do it again. And then, so this drug holiday will help us to replenish what we are missing.
But in general, if you keep a good oral health, you don't really need to use a mouthwash.
Exactly. So
Correct.
the mouthwash is supplement in addition to. So if we look back, the simple brush, you can identify it to the maybe around maybe 1,000 years before BC. So the people understood that keeping good oral hygiene is very important, and they used the cleaning things many years ago. So, but for some people who have problem with dexterity, or they cannot exercise oral hygiene, or they cannot afford to go to the dentist, which you have to do every at least twice a year, for a good dental cleaning, and sometimes even more. Then chlorhexidine is doing disinfection. It's a chemical cleaning rather than physical cleaning that is done by a dentist or a hygienist.
Okay. What about the water pick? Sometimes that can be another thing that can be adding an element, right? If you have some issues with like dexterity or things like that.
Yes, it's a good thing, but I don't think that it's a good replacement for brushing.
Of course, as an addition to it, yeah.
Yeah, so as an addition, it's very good, and it helps. But there's nothing like a good brush, and you can actually do this test where you get a disclosing tablet, which is something that you chew on, and it will stain the plaque on your teeth. And
Yeah.
then you look at the mirror and you see, oh, there's a red staining here. You have to remove it,
We
and then
used to, yeah, we used to do that with the kids, with my kids, when they were like to kind of show them, like, look how not great you were cleaning your teeth. They were like, oh,
you'll be surprised, that I think probably half of the patients, they don't know how to brush their teeth.
yeah.
And they do it in a wrong technique. And we need to show them how to do it. So we need to reinforce it. And this is especially important, in patients that are cancer patients.
Mhm.
So going back to the, so oral health is very important in general, but in this patient, it's especially important because their immune system is already compromised. So, the inflammation that is caused by plaque
Mhm.
is not managed by their immune system. And they also have some other problems, like in head and neck, for example, they will have dry mouth. So they also have reduced salivary flow. In general, the saliva will wash away many of the bacteria and the debris,
Mhm.
in addition to the cleaning, but in the brushing. But in patients that have dry mouth, it's not happening. So now, there is another factor that makes them, more sicker and have more morbidities. So they will have more oral infections. That will be, some of them will be yeast infection.
Yeah, I was gonna go there just because what I see a lot, and I treat a lot of head and neck cancer patients, is that the mucositis that they're dealing with as they're going through radiation. So we really try to encourage them to increase their cleaning, right? Every time they eat something, use a soft brush, try to clean as much as you can, make sure you're not making the gums bleed, those kind of things to try to avoid some of that. But yes.
Right. So what I wanted to emphasize, because you're seeing those patients, is something which is very important. So we work with the radiation therapist very closely, and we strongly recommend that that when a patient is being diagnosed with head and neck cancer, and this is the treatment of choice for these patients is going to be radiation, that they get checked by the dentist first.
Yep. Mm-hmm.
Because we want everything that is possibly can be done before the radiation. So teeth that needs to be pulled out, especially. And then we need to talk to them about fluoride.
Yep.
And do individual trays so they can then apply the fluoride into their mouth and carefully cover the teeth. Because what we see after the radiation, we see a huge drop in salivary flow, in resistance to cavities, and in infection. And it's very difficult to treat somebody in the air, especially teeth that were in the area of the irradiation. And then if we do something about that, let's say we do extraction in an area that was radiated, patient can get osteoradionecrosis, which is very difficult to treat. And there's a whole story with hyperbaric chamber, which has been shown not to be very effective anyway.
Oh, wow.
So we want to make sure that, and that's why a patient that has a dentist, they need to talk to them about, I'm going to get radiation. Can you take care of my teeth before and get me those trays and give me fluoride? Because the fluoride is going to be very important in the prevention of the caries that is going to develop in the future.
So when do you advise, so let's pretend a patient get diagnosed with head and neck cancer, and let's pretend the option is HPV positive and the option is gonna be we having a good outcomes with just radiation and chemo and no surgery. So if we go in, like, what is that time frame that will be ideal for them to protect their teeth?
So the time frame is between diagnosis and before they start radiation.
Okay.
And usually I would like to give them at least 3 weeks
Okay.
to a month after the dental treatment before they start the radiation.
Okay.
So, in case they need extractions, then the socket will heal and the patient will feel much better, with the healing. Because once you start radiating, it's going to affect the healing of the area of the bone.
How about after treatment? Do you continue doing those fluoride treatments?
So then then you're more limited in what you can do to the patient, like extraction. That's a big problem then. But you can still do, maybe cavities, take care of the cavities. You can definitely do a good cleaning every 4 to 5 months or so, and definitely fluoridation. So fluoride. This will keep them, in good shape. And there are commercial products. It's a prescription, but I'm sure that you can talk to them and they can. I'm not sure why it's under, it's something that needs prescription, but Prevident is the thing that we recommend. It's a toothpaste that they can brush their teeth every night before they go to sleep. Okay. And it's 1.1 sodium fluoride. It's a prescription. The dentist can prescribe it to them, or the medical doctor. But there's something they should be doing for the rest of their life, or using the gel in the trays that that the dentist did for them.
Okay, that was gonna be my next question. That was for the rest of their life, pretty much.
Yes. So the problem is that the risk of osteoid necrosis and the damage to the salivary glands, that's not going to get any better. Okay. If anything, it's going to get worse. Because usually the amount of radiation is going to be more than 5,000 rad. Mm-hmm. And that's irreversible damage to the salivary glands. But I wanted to talk something very, very exciting. So there are 2 projects which are new. Okay. For patients that had the radiation in the oral cavity, and they have almost complete loss of saliva in their mouth. Perfect. So far, we were recommending drugs such as Evoxac and Salagen, but there is I think phase 2 and phase 3 studies that look at gene therapy. Oh. Yeah, so this is very exciting. And, some patients, if they are lucky, maybe they can get into the clinical trial. Okay. Where they are going to introduce a specific gene for aquaporin. That's it's something that will increase their salivary output. They will use a virus to cause the gene to enter the gene into the salivary tissue. So this is not standard of care, but in a clinical trial they can do it, and the patient will have then much more saliva. Oh wow! Yeah, so this is one. The other, other than aquaporin, there is another gene therapy. So gene therapy is very, very exciting. But there's another technique which is called okay, this will come to me in a minute, where they're going to edit specific genes. Okay. And CRISPR. Okay. So it's a CRISPR. Okay. And in CRISPR, they can actually cut a specific gene and then paste the right gene into the genome, into the DNA. So I'm just mentioning it so people will know that there is some silver lining, at the end of the tunnel, especially for chronic conditions such as post-radiation xerostomia, which is very, very bad.
Yeah, yeah. And this is the common denomination I see a lot on patients. Like sometimes we see them post, either because they have a mandibulectomy and they continue working on the jaw, lymphedema, or neck dissections and so forth. And that's one thing. It's like, is anything you can do for dry mouth? And it's like, that's kind of like, yeah, that's like
Yeah.
very exciting.
Because you think about that, you communicate with the world with your mouth. Just
Yeah.
think about the baby, the communication with the mother, food, everything is through the mouth. When they don't have enough saliva, they have difficulties in speech, in talking, in swallowing. They cannot even have a cracker, and swallow the cracker because of all the, lack of saliva. So you don't appreciate saliva until it's actually gone,
Yeah.
and then it's already too late. But what I recommend sometimes is just some simple things such as stimulating whatever is left in the salivary glands, lemon drops with no sugar, so they can suck on them. Sometimes chewing gum that is without sugar, but with there is some special chewing gum for patients that have post-radiation cavities. And let's see what else.
A biotin or something like that, right? That's like, it's a biotin.
Yeah, well, biotin, of course, is artificial saliva. The problem with biotin that it has a little bit, it's watery, but after the effect is very short-lived. So after a few seconds, it's like you didn't try. So it lacks the mucins in the saliva, the thing that makes saliva really sticky.
Okay.
And there was something else that I saw. There was actually a device I saw I just came back from the meeting there was oral medicine meeting that I attended in Las Vegas, and they were talking about having something like a device in their mouth, and the device will have like a little reservoir, and the reservoir will release slow release of saliva.
Oh, like almost like a orthosis?
Yeah, something like that. So instead of having, you rinse like once in a few hours and you spit, right? Like Saliram, Salivart, or biotin. Here you have like a little box somewhere that you carry in your mouth, and it will release some products, very slowly over 24 hours, and then at night you can fill it again, and it will release the saliva next time when you use this device.
Very interesting. So, what are the most common oral health issues? I mean, what are the early symptoms and signs that patients should not ignore? Like, if they let's pretend they go to the dentist, or some people don't, right? Some people is like, well, I can only afford to go once a year, or whatever it is. What can they do? What is the first thing that should be like call the attention to really seek for further examination?
Right. So everything that is different and does not resolve within 2 weeks
Okay.
should be examined. It can be like a little a nodule, like a raised lump or bump or a nodule, especially on the tongue, because that's a high risk area on the under the tongue, on the tongue, on the sides of the tongue. Or if there's an ulcer, like a little ulcer on the tongue that does not heal, non-healing ulcer, or the soft palate. And I think that, overall, even if you cannot get dental treatment, get an oral exam at least once a year. So you have, because, it's very important, the early detection. If we find it in a timely manner, then, the most of the problem goes away.
Is anything specific for patients? Like we talk a lot about radiation. How about patients who are going under chemotherapy? Is anything that you're advised to help them a little bit through that oral condition that they develop through chemo?
It's very similar. So actually, before they get the chemotherapy, we want to make sure that they get the dental treatment done before.
Okay.
Again, because what's going to happen is the chemotherapy is going to suppress their counts, their bone marrow. So let's say they have leukemia, and now they have chemotherapies that will reduce the number of the white blood cells.
Mhm.
It will then, if they have anything that in the oral cavity, that let's say they have a big cavity, okay, that was not treated. Now it can flare up and it can cause sepsis. It can kill the patients because of a dental infection.
Okay.
Because the chemotherapy is actually reducing the counts to such low number that any infection will flare up, and there's no immune system to take care of that.
Okay.
So there's a protocol here at UF Health that we see all the patients before they get the chemo, and we take care of the big issues before they get the chemo, and then some of them will also get bone marrow transplant, and then it's the same thing. We want to make sure that we eliminate all the focus of infection before they get the bone marrow.
Got you. Um, what is one message you want everyone to take away about oral health and cancer awareness?
Okay, so the message I want patients to know is that oral cavity is a very important part of the rest of the body. And because of everything we mentioned about the oral systemic connection, it's very important that the patient has a good dentist that they trust, and they have at least one annual exam. Like you have a breast exam, a mammogram, or like you have a prostate exam. You should also have an oral exam, because we want to make sure that we catch things when they are early and not when they are very late. And in the oral cavity, it's very easy for the cancer to hide or to be in places that you don't see, because who is looking under the tongue or the back of the tongue or the palate? Most of the people are not doing that, and that's why the dental exam, the oral cancer screening is very, very important. Now, there are very many ways to do visualization of the cancers. There's UV light, and there's different colors, but the best, we can't really tell, what is cancer, what's not, if we don't do a biopsy. So biopsy, if a suspicious area, is mandatory to find out, because that's still the gold standard for diagnosis.
That's amazing. Oh my God, Dr. Katz. Again, we can continue on and on for another hour. You're just so full of knowledge. I love to talk to you. It's like I learn so much every single time.
Oh, it's my pleasure. And what we can do, are your listeners watching the podcast, or they're just listening to that?
Both. Now they're in YouTube now.
So maybe we can do a presentation where I can show you some cases.
Yes, that will be awesome. Yes,
And then they can see. I don't mean to scare them. I just want them to be more knowledgeable about things that they can be looking and asking their dentists.
Yes, I love that. I would love for us to do like a third part. I know you wanted to share your PowerPoint presentation last time. I think it will be a great idea.
Right. And also, I want them to be asking their dentists, what is the association between sex and oral cancer?
Yep.
And because it's something we traditionally don't like to talk about this, okay? But the patient can raise the question.
Yep.
And then they can get information from the patient in a form of a brochure or something, if they are more embarrassed to ask. But the thing about vaccination of children, of boys, is in my view, is very important, and it will definitely reduce the numbers. So far, we still see every year about 50,000 new cases every year of oral cancer.
Yes.
And we can cut it significantly if we vaccinate the boys when they are young.
And I think you're right, because we've seen as well, I have seen young adults, we're talking on the 20s, 30s, with no history of smoking with oral cancer, which
Yes.
more likely, well, one of them was no HPV positive, which is really rare, but I'm sure that has to be a correlation there.
So that was very interesting, Darlie, that you mentioned this, because in the meetings that I was, they were actually talking. So this head and neck surgeon, she was saying exactly the same thing.
Yeah.
She's saying younger people and women, some of them are not even men.
Yeah.
And it's not HPV related.
Yeah.
So what is it? And they believe that there are some oral microbiome, some kind of a bacteria, which is called fusobacteria, that is associated with this.
Yeah.
So this is like a shift in paradigm, and again, it just emphasizes the fact that oral hygiene is very, very important.
Yeah, and I think that besides the oral hygiene as well is, our nutrition, right? The biome is not just to keep something clean, but what are we putting in our body every day, right?
Right,
How much
exactly.
exposure do we get for all this toxicity and chemistry and everything that's happening in the world now, right?
Yeah, and we can talk about this maybe next time, about the vitamins and the antioxidants and everything that we need for our microbiome to be happy.
I would love that. Yes.
Yeah. So more like a naturalistic things, how we, I have a patient who keeps getting dysplasia, which is a pre-cancer on their tongue. She had it for maybe 20 times they cut her tongue. There's nothing we can do for her other than, I talked to her about eating blueberries every night before she goes to sleep. Because blueberries are big in antioxidants.
Yep.
And, she's still having the issue. But I think that, if we have not been doing that, her prognosis was even, worse.
Yeah, super interesting. I would love to do that with you. We have to bring you back for a third
Yeah,
part, and then we do some cases and talk about all this.
Sure.
Holistic. What else can we do to help our health in general? So I think will be great.
Okay.
Okay. Thank you so much, Dr. Katz, for joining
Welcome.
me again.
We'll be in touch.
Okay, perfect.
Okay.